Following a diagnosis of metastatic breast cancer, patients can experience a wide variety of emotions. Most commonly, patients experience sadness. This is an extremely difficult time in your life, and this may be one of the hardest things you've ever heard. They can also experience shock, disbelief, and also anger. This diagnosis is life-altering, and it can really shake somebody to their core. And it's really important to cope with these emotions in the way that's right for you so that you can work through them and fight this with everything you have. If you're experiencing these emotions, it is so important to talk to your healthcare provider and let them know what you're experiencing. There are resources that they can direct you to help you cope with these emotions. A social worker can be extremely helpful, and oftentimes a cancer center may have a therapist that they work closely with who work with patients who have the diagnosis of cancer. Support groups are an excellent way to connect with people who are going through something similar to you. But for other people, they do choose to keep it more to themselves and may not want to sit and listen to the experiences of others, and that's okay. For everybody, this is extremely individual. But it's also important to know that even if you go to a support group, you don't have to share. You can just go and listen, and that may also be very therapeutic. Living a healthy lifestyle while you're coping with breast cancer is very important. Especially when it comes to side effects of treatments, I tell my patients that nothing is more important than getting up and staying active even when they feel fatigued. Even just taking a few minutes of walking or going outside a few times a day can be extremely helpful. I also tell my patients that it's very important to speak to a nutritionist. A nutritionist can sit down with you and work out a meal plan that can work for you. After the diagnosis of metastatic breast cancer, it's important to continue doing the things that are important to you. If you want to continue to go to work, go to work. If you want to continue with hobbies and other interests that are important to you, I encourage my patients to do that. A lot of times patients ask me if I can travel, and there are definitely times within treatment that most patients can travel and go on vacation. There really is no right or wrong way to cope with this diagnosis. It is extremely individual. I tell my patients that it's very important to stay positive. There is hope. Maintaining a positive outlook and attitude on this battle is very important for your emotional and physical well-being.